Welcome to Aesthetics Unfiltered, honest conversations about regenerative, doctor-led aesthetics. This series is designed to share relevant, evidence-based information so you can make informed decisions about your skin and treatment options. Today we're discussing all things hair loss, a huge topic, Kerry.
Very big.
Yeah, massive.
Yes, with men and women, especially women, but it does affect men, obviously.
Definitely.
But you've got some good information
I do.
that you're going to share and we're going to discuss.
Both male and female pattern hair loss is actually called androgenetic hair loss, and it obviously affects both males and females. It affects them in different ways and there are different causes. By the time we're 70, 80% of Caucasian males will have some form of hair loss, and 60% of females will also suffer the same fate, to varying degrees, but it can be quite distressing.
And that's fairly high stat.
It's huge, yeah, it's massive.
When you think about it.
Yeah, and for men it often starts earlier. So men will notice that the front of their hairline starts to recede, and then eventually it will happen on the crown or the vertex of the scalp as well. Women notice it happening in slightly different patterns. So it's usually along the part line. So women might find that they're losing hair along their part and it's just looking like it's wider. They also might find that their ponytail is getting thinner with time, if they have a ponytail.
So do you think that more when women, after they've had children, that they notice that, or is it something that can be something that they have from very young?
Yeah, good question. If we're talking about androgenetic hair loss, so genetic related or age related, that is slightly different in its pattern compared with pregnancy related hair changes, which I think we'll talk about in an entirely separate unit because it's such a huge topic, skin and hair changes and nails in pregnancy and breastfeeding. But women who are suffering androgenetic hair loss will notice it usually from their 40s, 50s, sort of that perimenopausal, menopausal time in their life. Before
they come to see you here at the clinic, what would be the steps that you would suggest for them to take before they make an appointment?
That's a really good question. So it's important to actually see your GP first before you come and see us. Obviously, I'm a GP, but here in our clinic, we're not set up to provide the same services, and often treating hair loss requires blood tests, investigations, a thorough examination. It might not be androgenetic hair loss, so it might not be age and genetic related. It could be an easily fixable problem like your thyroid being off, a vitamin D deficiency, iron deficiency, that's a really common one. So it is important to go and see your GP to rule out common causes of this kind of pattern of hair loss, because it might be an easy fix and you might not actually need to come and see us for those more advanced treatments.
And I think that's probably a really good message, is that it's not talked about enough.
No.
People are embarrassed. So by going to your regular GP that has your history is probably a really good idea. And yes, it saves coming to us and us saying, well, have you actually had this tested? And
examination and investigations are really important. When you're having a look at someone's scalp, you've got to make sure that it's not actually a dermatitis problem, like a seborrheic dermatitis, that oily kind of plaques or flaking that you can get in your skin sometimes. That's a common cause of hair loss, and it's easily treated with a steroid and like antibiotic or antifungal cream. And your hair should come back. There's also different types of hair loss that can happen due to stress, and that's usually a different pattern where the hair falls off in clumps and it leaves you with these little circle patches in your scalp.
Is that alopecia?
Yeah, it's a form of alopecia, absolutely. And again, that is something that should be investigated with your GP who knows you best, because often you'll need a referral to a dermatologist to have steroid injections into the skin to try and address that problem. And it needs to happen quite quickly. So if you notice that, it's straight to the GP, straight to the dermatologist with a referral.
Okay. Yeah. So say they've been to the doctor, they've had their blood tests and everything like that. What are some of the things that the doctor, if they've got it's come back that they have got problems, they need to take medication, topical, orally, what can we expect?
Obviously, if there's a problem on the blood tests with the thyroid or a vitamin level, then that should be fixed with thyroid medication, and further investigations are probably needed. But there are common tablets prescribed to improve androgenetic hair loss for both men and women, and the tablets are different for men and women, so it's a different drug. These are pretty easy to prescribe, but you do need blood tests before you start taking them. For men with finasteride, it's important to have your prostate-specific antigen level tested first, because the finasteride can actually artificially lower your PSA level. So if you ever have a problem in future with your prostate, it's going to be difficult to monitor it if you've been taking finasteride.
You need a baseline.
Yeah, you need a baseline, exactly. Yes. For women, spironolactone is the most commonly prescribed tablet. That's actually a diuretic, and so it has side effects. So you need your kidneys tested first and your liver, and then you need to be able to check in with your GP regularly and make sure that you're not having the side effects of dizziness, that you're weeing too much, because it's quite annoying. It can also cause irregular vaginal bleeding sometimes. So that's all things that you probably don't want to be talking to your aesthetic doctor about. You don't want to be in and out of clinic.
And I think that's a really good point, is that too, I think that you get the best results if you can stick with the same doctor, or at least within the same clinic where they have access to your medical records.
Absolutely.
I think that's really important.
Yeah, definitely, that ongoing care.
When you're looking at for ongoing care for anything really.
And I know it's hard these days. Lots of GPs are leaving general practice, or we're increasingly difficult to get into. But as long as you're going to the same clinic that you trust, and you're seeing a doctor who has access to your notes, that's really important. So they're your two most commonly prescribed tablets for men and for women. There's also topical treatment, like you touched on. It's called minoxidil. This is easily accessed over the counter. So most chemist warehouses, lots of chemists have it. It's called Regain or Rogaine. Comes in lotions or a foam. It needs to be used pretty much every night, and it does take time for results to be seen, but it does work, and it's not that cheap, but a $50, $60 bottle will last you 3-4 months. It's a bit sticky, and it can be a little bit annoying. It's also toxic to pets. So you've got to make sure that, got to make sure that it's well dried and you've washed your hands before you're patting your cat or dog. And hopefully your cat and dog aren't jumping up on your pillow over night time, because, it's a bit gross.
Not very nice.
Not very hygienic. But this topical minoxidil, easily available over the counter, and it works. It works best when you use it with the tablets that your GP might prescribe. But so it's really easily accessible. It's what you should be doing.
Yes, they've got to be committed to it.
Yeah.
And slow results, but if you are consistent,
that's right.
Like anything, whether it be skincare or anything, consistency is obviously
consistency is key.
Yes.
So once you've tried your tablets and your topical minoxidil, and you've been on them for 6 months, and you're thinking, yep, I've had a bit of improvement, but this could be better, that's where your aesthetic doctor comes in. So there are adjunct treatments, extra treatments that we can do to try and boost that hair growth and slow down the hair loss. Some clinics offer PRP, platelet-rich plasma. There is some evidence that helps. It's not for everyone, and it does depend on your underlying health conditions. PRP involves taking some blood, spinning it down, and then injecting the platelet-rich plasma into your scalp.
At the conference recently, they talked about that. Now, I think the important thing is that PRP is very dependent on age, isn't it?
Yes, and the underlying
the
health.
machine that is actually in the clinic, and unless you've bought a really expensive whiz-bang one, it's not going to actually
it's not optimal.
No, you're not going to get the optimal results. Yeah. So I think that's very important for people to, if they're thinking of PRP, it's not just any clinic that's got a PRP machine, because
there's PRP and then there's PRP.
Yes, you need a good medical grade device to get the best results, and age plays a very big part in that. Unfortunately. Age plays a part in hair loss in general to start with. So I think with PRP, that's a good thing. There's other things at clinics that...
Yeah, that help. So PRP obviously involves lots of injections into your scalp. So it stings and it's messy, there's blood. So it's not for everyone. Then there are things like topical exosomes. So I think we could talk about exosomes a lot.
And I think we will do a separate session on that.
Yeah, but this is a great option for people who want to add something to their regime of the tablets and the topical minoxidil. Exosomes are little vesicles that improve cell-to-cell communication. So it's a liquid. They come from, our brand comes from healthy Korean donors who donate their fat cells, and then they extract the stem cells from those fat cells and they extract the exosomes from those stem cells. So they're these tiny little vesicles that contain proteins that move between cells and tell them to work better. So it can increase your hair growth and slow down your hair loss. And there are different ways to get those exosomes into your skin. You could use microneedling, but if we're trying to avoid needles and pain, you could also use something like the Impact TED device. That is something that we have in our clinic. It uses ultra low frequency ultrasound to create little microchannels in your skin. So it doesn't hurt. It's this little device that gets rubbed over your scalp. Doesn't hurt. It can get a bit warm, can get a bit hot, but when used correctly will not cause burns.
And there's no numbing.
No, you don't need to numb. There's no mess, there's no blood, no needles.
No. And I think when we're seeing the patients coming in, they're in and out, they'll do it in a lunch break. It's a very quick, a very easy treatment that we've seen very good results from. But I think the thing with exosomes, and we will talk about that in a separate thing because there's so much to break down on it, is I think the important thing is where we get them from is the only place in the world, I believe, that actually screens them to such an nth degree that there is a lot of confidence in the industry that they are very good. But once again, there are exosomes and there are exosomes in the industry. So you have to be very, very careful of clinics that are offering those type of things because they put out papers, the reps, and it isn't actually sometimes on the actual exosome that they're selling, and we see that across a lot of things in our industry.
The aesthetic industry.
Yes, the information papers or the papers that give these great results, and the company that we actually get the exosomes from, I think they have over 65.
65. Yeah, I think you're right.
65 independent sort of
clinical papers.
Clinical papers, which is huge in this type of industry, that they've actually got that information out there. So, but we will cover more on exosomes another time.
So the Impact TED and exosomes are a great additional treatment if you're finding that your tablet and your topical minoxidil are giving a bit of a result, but you're not quite happy. Something to remember though is that you will need a few goes with exosomes before you see improvement. Like anything in this industry and like everything with hair growth, treatments create long, slow results like over time. So we see good results with exosomes probably after the 5th or 6th treatment. You have a treatment 1 month apart until we start to see good hair growth, and then you can probably space that out to 6 weekly, 2 monthly, depending on how you're going.
You just got to realise, I think if you're having anything like this, it is time consuming. Make sure you do your homework with your GP beforehand because that's your first port of call and that will be what you want anyway before you come in. And
I would love if everyone could see their GP, please, before they come in and have a chat with us about hair loss, because there are so many simple things that you could be doing that don't involve coming in here every month. And then it does only take 30 minutes.
Having Libby say, look, you really need to go back to the GP and have this investigator first. So I think that's it. And then we can talk about exosomes another time.
Yeah, sounds good. Yeah, it's a huge topic. Yeah.
And so we'll finish up there with your little spiel.
Great. Every face is different, and that's why personalised, evidence-based planning matters. If you have specific concerns or want tailored advice, consider booking with your local doctor-led aesthetic clinic as the first step before committing to any treatment.